the same treatment option cannot be applied for the both of them because of the difference in location. Alright, today we are going to be looking at several factors that doctors put in place before they suggest or advise you to take on a particular treatment option. Now, I'd like you to know that whatever we discuss here on this platform is purely just for knowledge sake and not for you to take action on whether you want to use it for your treatment. Alright, let's continue. We are going to be looking at some of the factors that prompt doctors to choose a particular treatment option for cancer patients. Okay, first on the list is the type of tumor you are having. If it is a solid tumor, for example, breast cancer or colon cancer or throat cancer, there's a treatment option that is usually available for that. For instance, if you are having breast cancer, a doctor could look at surgery, but he will not just look at surgery just directly. He have to look at other factors like the kind of biomarkers that are related with your breast cancer. And then he has to also look at your immune system. How will your immune system respond to this surgery, for instance, or the particular treatment option he's about to suggest for you. Alright, now you could be having a solid tumor, let's say a brain cancer, and someone who is having, let's say, a breast cancer. You know, these are two different types of cancer based on the location, right? So the same treatment option cannot be applied for the both of them because of the difference in location and, of course, the kind of organs that are surrounding that particular tumor. So for instance, if a solid tumor is formed close to or within a major blood vessel, let's consider something like pancreatic cancer that is very, very close to some major blood vessels that cannot be tampered with. You see, they can't suggest surgery for such a tumor. Maybe the doctor can refer you to, chemotherapy or radiation or immunotherapy based on what will work most favorably for you. Alright, yes, another factor that is usually considered during cancer treatment options includes comorbidities. If you have other existing medical challenges, let's say you are having a particular kind of cancer and then you're also having a diabetes, you're having high blood pressure, you're having kidney disease, and maybe lung or liver disease, for instance. These are factors that must be carefully considered. How will the drug, for instance, if the doctor want to place you on chemo, how will this drug or chemo interaction affect these other organs? So the doctor will like to consider your overall health status before he choose or refer you to a particular treatment type. So they don't just choose for you. They don't just look at you and say, okay, let's do a surgery for you, or let's place you on chemo, or let's place you on this. They must definitely look at what is best for you based on your overall health status. Yes, another strong thing that is usually considered during cancer treatment option is access and availability of the options. You see, if for instance the best treatment option for you will be immunotherapy, can you afford it? If for instance is immunotherapy, is it available in your location? Will you need to travel out? Can you afford traveling out? If for instance they want to use viral therapy for you, is it available? Are there experts in that field that could do that for you? So all of these things are some of the factors that will be put in place. So usually they look at which one is safer for you and which one is available, which one is accessible for you at this particular point in time. Alright, so lastly, the last factor we are going to be looking at for today is the stage and grade of the tumor. Now, if for instance you are having stage 1, it means that the particular tumor we are looking at is localized, it has not spread, it has not metastasized. And if we are looking at your tumor and it is at stage 4, for stage 4, it means that it has metastasized, it has spread, it has become very aggressive. So this will also inform your doctor to look at the best treatment option that will be able to handle the level of aggression of your particular kind of tumor. So when you visit an oncologist, don't blame him for the treatment option he's suggesting for you. Nevertheless, you still have your right not to accept, but it is good you collaborate with your oncologist for the best treatment that will work for you. Remember to like, share, and comment.